moving to Anju Vijayan, Himalayan University, Arunachal Pradesh. Anju Vijayan.
I'm Anju Vijayan. I'm talking about the factors associated with depression among transgenders. Here I'm studied about some transgenders who are living in Cochin area. One candidate explained detailedly about the depression. So I'm not talking about that due to lack of time. Here I'm talking about the depression in transgender people. Almost 50, more than 50% people are depressed among transgenders because of their partiality or harassment from family, society. Everything are the reasons for that. Then in Indian culture, we are calling them as hijras, but most of the time we are not considering them as human beings itself. That is the major problem of them. Whenever we saw a kid as a transgender, the family will reject them, and they run out to other places, and some other people will use them as sex workers, even if the kids are also harassed by these problems. So depression is a common thing among these transgender people. There are some and suicide ideation indicating that transgender people encounter a variety of issues in society. Then depression and anxiety are linked to prejudice and victimization, and depression and anxiety among the most frequent mental health issues among transgender people. According to research, depression was the most frequent mental health concern among transgender persons, with more than 60% of those in this category experiencing depression. Then suicidal thoughts is also a major problem of them. Suicide is one of the most tragically determinant causes. Yes, sir? Sir?
Yeah, you can continue, ma'am. No,
okay. Most transgender individuals are familiar with the concept of suicide, which is defined as considering or preparing to commit suicide. Suicide ideation was shown to be substantially linked to depression. There are several risk factors for suicide among transgender people, including drug misuse, violence, sadness, anxiety, humiliation and prejudice, rape, sexual abuse, familial rejection, and lack of social support. Then attempt on suicide is a very common. 30% of transgender kids have tried suicide at least once, while 51% have simply considered it. Then self-harming. A history of physical or sexual abuse was recognized as a key risk factor for behavioral issues relating to mental health, such as depression.
You can go to the conclusion, ma'am. You can go to the conclusion.
Okay. In the findings of this study revealed that transgender persons have much greater rates of mental and behavioral issues than the general population. Anxiety, sadness, suicidal ideation, drug addiction, self-harming activity without suicidal intent, and HIV infection were among the most frequent disorders. Friends, acquaintances, classmates, and professors, and even family members harass and abuse these people on a regular basis. HIV infection and other sexual misconducts are increased when you have a lot of sexual partners. As a result, many of these actions must be prevented by educating members of the community, particularly those who have direct contact with transgender persons. Governments should also...
Yes. Thank you. Okay, a very nice presentation. Due to paucity of time, we will move, ma'am. Thank you.